Hello everyone, I am Dr. Nakul Kothari from SRCC Children's Hospital, Mumbai. We have with us today Dr. Vibhor Borkar. He is a senior pediatric gastroenterologist. We have been seeing a lot of Wilson's disease cases here, and we have also started our liver transplant programs in the last few months. So we will be talking about Wilson's disease in detail today, and Dr. Vibhor will enlighten us more about it.
Thank you, Dr. Nakul, for the introduction.
So Dr. Vibhor, can you tell us what is Wilson's disease?
So, Wilson disease is a rare genetic disease in which body loses capacity to remove excess of the copper from the body. We ingest copper from the different kinds of food and drinks that we take. Now, as this copper accumulates inside the body, it accumulates in many organs like liver, brain, kidney and eyes. When this goes in excess in amount, it damages this organ and we see a various clinical symptoms from this disease.
Okay, now we know more about it. So, how is it caused? What are the causes of Wilson's disease?
So, this is very rare genetic disease. Almost 1 in 30,000 individuals can suffer from Wilson disease. So, if you suppose our Mumbai urban population is around 2 crore, so we must be having around 600 to 700 of children around us with Wilson disease. So though it's rare, it's not like that we don't see children with this. So being a genetic disease, when an individual gets two mutated, means defective genes from each parents, that particular individual will have this disease. And as parents are carrying only one affected or a damaged gene, they do not suffer from this disease. Similarly, if one child is affected with Wilson disease, there is chances that 25% of the other siblings can also have a Wilson disease. This generally is caused by the gene which is called as ATP7B, and these genes get mutated in this. That's how people get these genetic disorders. And so they may be silent in previous generation, still one person can have genetic disease.
So Dr. Vibhor, how will the parents realize that their child is having Wilson's disease? How do they present with? What are the common complaints they come with?
So Wilson disease is caused by accumulation of copper within the body, and this copper accumulates in different organs. So like liver, brain, kidneys and eyes, they are the most commonly affected organs. So when it damages, when it accumulates inside the liver, it damages the liver, and it can be present as what we call as a cirrhosis, where the symptoms are slow to onset, and there the patient can have weakness, fatigueness, they can have jaundice, swelling over abdomen or tummy and the legs. Sometimes there can be very catastrophic presentation that we call as a liver failure or fulminant liver failure, where the symptoms occurs within days. Child can have a deep jaundice, they become a little bit unconscious, and it is within life-threatening condition. They will need ICU admission and immediate treatment. Then when there is a brain damage, what happens that a small amount of copper accumulates in the basal ganglia, which controls the muscles coordination. So the muscles become tight, so it causes tremors, it can cause changes in child's handwriting, playing ability, even sometimes the swallowing. So this is how the brain manifestations present. About the kidney manifestation, they can have hematuria, sometimes called as a renal failure or a renal tubular acidosis. Eyes manifestations are generally symptomless. Only they can be picked up by eye specialists during a routine checkup.
Oh, that sounds scary. So how dangerous is Wilson's disease?
So all the organs in which copper deposits, it causes a progressive damage of this organ. So in the liver, in the cirrhosis, if suppose the cirrhosis present in the late stage, it cannot be sometimes reversed with medication, and this late stage of cirrhosis can be again life threatening. Another presentation of liver disease that we saw was a liver failure. Again, it is a life threatening condition. In both this situation, only treatment that we have is a liver transplantation. Now the CNS damage is generally permanent, and even if we diagnose it after the damage and we start the medication, the damage of the brain may be irreversible. So that's why it's very important to diagnose this condition when the damage is not permanent and the disease state can be controlled effectively.
And how do we diagnose Wilson's disease?
So Wilson disease can be diagnosed by doctor, like pediatric specialist, pediatric gastroenterologist, pediatric hepatologist or gastroenterologist. Generally they will ask some blood test, which will be liver function test, ceruloplasmin, then urine test like 24-hour urinary copper and eye examination. These are routinely done. Sometimes MRI brain and endoscopy will be required. It can be confirmed by doing a genetic test for the mutation. Also, if somebody in the family has Wilson disease, all the first degree relatives of this child means and siblings, mother, father, even the grandparents, they can be screened for presence of Wilson disease so that it can be diagnosed in the early stage.
So Dr. Vibhor, is this treatable? How do we treat Wilson's disease?
We know that Wilson disease is a genetic disease. So because of that, there is no treatment. What we can do is we can control the disease. The medicines that are used for Wilson disease, they remove the copper from the body. As this copper is removed from the body, there is also that excess copper which is deposited in the different organs, it is also removed. So we give the chance for the body to repair this organ, and that's how this is treated. So because we do not completely cure it, it is very important that this treatment for a Wilson disease should be continued lifelong. If we stop this treatment in between, all the copper can accumulate again and can cause the liver damage again. So we must ensure that the treatment should be lifelong. These are some oral medicines is given which is consumed on a daily basis and it can be controlled. Now sometimes what can happen, that liver damage is very advanced. So even if we start medication, it may not get under control. So it's very important to start this medication in the early phase of the manifestation. We also discussed that the first degree relatives of the affected child should be screened. If we get someone who is asymptomatic and having a Wilson disease, then this child or that person will also need a treatment so that there is no further damage to the affected organs.
Okay, so is there any special diet? What diet do kids take who have Wilson's disease, who are suffering from Wilson's disease?
Yes, so this is a very important question, and most of the parents ask about what diet should be taken, because they say this copper is ingested from the food and some drinks. So we should avoid all this food which contains very high concentration of copper. The most common foods are chocolates, chocolate drinks, mushroom, organ meat like liver, kidneys, nuts. Apart from this, also this water which is stored in copper vessels. Quite many families have a tradition of drinking water from the copper vessel. So in this particular individual, this should not be done. Also, now if you see, there are many companies have started producing RO water with copper. So also this kind of filter should not be used in the families who have a Wilson disease.
How do we prevent Wilson's disease?
So Wilson disease is a genetic disease, so it cannot be prevented once it is in a particular family. What is in our hand is to diagnose this disease within time and protect the affected individual from the advanced manifestation of this Wilson disease. If any particular individual has a Wilson disease, he should undergo a premarital genetic counseling so that we can plan how its risk can be decreased in a further individual.
Thank you, Dr. Vibhor. That was very insightful, and we have more understanding about Wilson's disease now. That was very kind of you.
Thank you, Dr. Nakul. Thank you.